Welcome to The Explainer. Today, we're diving into Conquering Needle Fear, the Parent's Playbook. Look, if you'd ever felt that absolute sinking feeling in the pit of your stomach as you pull into the pediatric's parking lot, because you just know your child is about to panic, I want to tell you right off the bat, you are totally not alone. Seriously, we've all been there. So let's unpack the science behind this fear and build your ultimate parent playbook.
Let's be real for a second about what this actually looks like. Does your child absolutely panic at the mere sight of a needle? I mean, we're talking about the screaming, the physical resistance, the desperate bargaining where out of nowhere they promise to eat broccoli for a solid year if you just let them go home. It is exhausting, right? And honestly, it leaves us caregivers feeling pretty helpless.
Well, let's dive into this because the numbers here are actually pretty wild. According to clinical research, nearly 100% of young children show significant distress during needle procedures. 100%. In the toddler years, this is a completely normal, universal response to an unprovoked, painful stimulus. Think about it. To a 3-year-old, a shot isn't medicine. It's basically just an attack. So if your little one is terrified, take a deep breath. They are actually right on track developmentally. But here's where the trajectory kind of splits. While that fear is universal early on, it naturally declines as kids cognitively mature and figure out the difference between safe medical care and actual danger. By adulthood, that number drops significantly. So, our big goal today? We want to give you the exact tools to help your child join that 70% who successfully outgrow the fear, rather than the roughly 30% who end up retaining it well into adulthood.
Now, let's look at the danger of doing nothing. I know it can be incredibly tempting to just cross your fingers and hope your child grows out of it on their own, but we really need to shift our perspective here. You can't just ignore this fear and hope it magically vanishes, because the stakes for their future are literally too high.
The research actually shows that untreated needle fear can lead to severe, lifelong public health consequences if it's allowed to solidify into a permanent phobia. Studies have found that needle fear is, surprisingly, a leading cause of vaccine hesitancy and noncompliance in teens and kids. And it snowballs, right? It leads to avoiding routine blood tests, refusing dental procedures, and ultimately, it creates this lifelong pattern of dodging absolutely necessary medical care. We really have to treat overcoming this as a critical, lifelong health skill.
Now, what's really fascinating about this, biologically speaking, is that unlike being afraid of the dark or maybe afraid of dogs, needle fear can actually trigger what's called a vasovagal response. In about 3 to 4% of the population, just the sight of a needle or blood causes this sudden physiological drop in blood pressure and heart rate, and that results in actual fainting. This deeply biological component makes needle fear entirely distinct, and it means we need a very specific approach to handle it.
Okay, moving on to the developmental shift. To properly support your child, you really need to know what's happening inside their head. Understanding how to treat the fear means understanding how your child's brain actually processes it at different ages. Because, as you can probably guess, a toddler's fear looks and feels very different from a teenager's fear.
Let's look at how this evolves chronologically. At ages 3 to 4, like we mentioned, it's just this universal raw fear. It's a completely immediate response to pain. But fast forward to ages 7 to 9, and we see a massive cognitive leap. This is when anticipatory worry really kicks in. They start dreading the appointment days in advance. Plus, social embarrassment might start creeping in. Then, by ages 13 to 18, if it's left untreated, it transitions into active avoidance of medical care. And that is exactly where the significant health risks really start to emerge.
Next up, proven tools and interventions. And hey, here is the really good news. We can approach this whole thing with some serious defiant optimism. We have incredibly strong, evidence-based strategies, pulled right from cognitive behavioral therapy and exposure therapy, to help us conquer this obstacle together.
A major systematic review of psychological interventions found exactly what works best for reducing all that needle-related distress. The absolute most effective tools? Distraction techniques. Think engaging them with virtual reality, or honestly, even something as simple as bubble blowing, which is great because it secretly doubles as breathing regulation. Combining those distractions with topical anesthetics, what pediatricians often call magic numbing creams, is highly, highly effective. And for the older kids, things like guided imagery, hypnosis, and deep diaphragmatic breathing give them active, tangible coping skills to manage their body's physical panic response.
Now, for kids ages 7 and up who have developed a really high level of fear, exposure therapy is essentially the gold standard. We do this by helping them slowly climb what we call a brave ladder. It's a gradual, step-by-step process. Step 1 might literally just be looking at pictures of needles on a phone. Step 2, handling a plastic medical syringe, totally without the needle. Step 3 could be watching a video of an injection online. And finally, Step 4 is receiving a minor procedure while fully deploying all those awesome distraction and breathing tools we just talked about. It builds their tolerance incrementally, one safe step at a time.
So the crucial point here is, what about that 3 to 4% we mentioned earlier, the ones who actually faint? Well, for kids who experience that vasovagal fainting response, we use a specific technique called applied tension. Basically, you teach them to repeatedly tense up their large muscle groups, like their legs and their core, during the procedure. Doing this actively maintains their blood pressure, and it is absolutely the best treatment choice to keep them from passing out.
Moving right along to the Parents' Playbook Do's and Don'ts. Now we're getting into the most practical part of our playbook today. As a parent, you are essentially your child's brave coach. So let's look at exactly what caregivers should and definitely shouldn't do when it's time for that next doctor visit.
First up on the list, do advocate fiercely for child-friendly practices. Seriously, speak up. Ask your doctor for that numbing cream, bring your own distraction tools from home, and go ahead and request the smallest gauge needles they have. But on the flip side, never allow total avoidance of necessary medical care. I know it's hard, but avoiding the doctor entirely completely prevents fear extinction, and it just allows that phobia to solidify into something much worse.
Next, do teach and practice deep breathing and coping strategies at home, long before you ever get to the waiting room. You really want to empower them with these skills in a safe environment. But whatever you do, and this is so important, don't hold a panicking child down forcibly for non-emergency procedures. The research is crystal clear on this. Physically forcing them while they are terrified creates traumatic associations that will make the fear exponentially worse the next time around.
So, when you're talking to them beforehand, try using this exact script. Just say, you'll feel a quick pinch, but you have your brave breathing to help you. It is absolutely vital that you are honest here. Never lie and say, oh, it won't hurt at all, because the second it does, you instantly lose their trust. And honestly, scratch that whole idea of using needles or doctors as a threat for bad behavior. That's a huge trap we want to avoid.
Then, right after the appointment, this is your perfect validation script. Get down on their level, look them in the eye, and say, "You were so brave even though you were scared." I just love this. This brilliant phrasing focuses entirely on praising their effort and their courage. It validates that their fear was 100% real, but it highlights the fact that they took action anyway, rather than you just demanding the total absence of their fear. It's a total game changer.
So, there you have it. You've got the tools, you've got the scripts, and you've got the science to completely rewrite how your family handles medical anxiety. So, I'm going to leave you with this one final thought. How will you change your approach to your child's next doctor's visit? Because the next time you pull into that parking lot, you aren't just a bystander anymore. You are their coach. Now it's time to put the playbook into practice. Thanks so much for learning with us on The Explainer today.